Hello, guys. Hi, this is Dr. Chefu, and we're going to be starting our live soon. And we know we're going to be talking about hair loss and mental health. So it's very important. So, my goal today is just basically to make sure that people understand that a hair loss is not just it's not just hair loss. It might be something else going on. Okay? So I'm gonna be talking to a very good friend of mine. I'm just gonna call him a friend of mine because I've known him for a long time. Dr. Jai, and he's gonna be coming on soon. So we're gonna be waiting for him to join me on live soon so that we can start. And we'll go. Let's see if he can join me. Dr. J. Let's see. Let's see if he can join me now. Sure there. Let's make sure he can join me. So hopefully he'll be joining me soon so we can talk about this issue about hair loss and mental health. Other than that, I've been doing fine. I had a hectic day yesterday, but I'm doing okay now. I feel much better today. I still have let's see, they joining me. Okay, let's see. Let us see. Dr. J, make sure that he's able to join me. And if you have any questions about mental health, hair loss, trying to understand the connection between hair loss and mental health, please type in the comment section. The comment section. Now we're going to be having Dr. Ajayi on live. Please type in your questions, okay? So that we can ask him all the questions, all the burning questions. And I'll see. So if you have any questions, please comment, put it in the comment section. So for everyone that's dealing with depression, anxiety, psychosis, bipolar. I mean, we're going to be diving into that. Hopefully, we'll be able to talk about all this in 30, 40 minutes so that we can understand more about the connection. Okay. Let's see. Dr. Jerry, he'll be coming on soon. If you have any questions, please comment in the section below or put it in the comment section below. Any hair loss question, any Good. Let's see. Should be coming up now. Why? Okay. Yeah. Is he able to join me? Should be.
How
Awesome.
we doing?
Good. Can you hear me?
Yes, I can hear you.
Okay, good. I can hear you. Yay. Thank you for joining us today.
Thank you.
But you know, I know you by Dr. J. But
Yeah.
I wanted to introduce my audience, tell my audience here how to pronounce your last names. So it's very important so they can pronounce it the right way.
Okay, no worries. I'm Dr. J. Ajayi, board
Dr.
certified
J.
psychiatrist. Good to be
Awesome.
here.
Awesome. Awesome. Now, I know you opened up your clinic now.
hmm
So I know you're going to do us a favor, telling us everything about yourself, basically what you do specifically. You know, people call psychiatrists, but they really want to know what you do and
Okay.
what your clinic really does for people and our community too.
Thank you so much for having me.
Awesome.
Again, my name is Dr. Jay Ajayi. I'm a board certified psychiatrist. That means I
Mhm.
went to medical school and then I went to psychiatry residency program. I
Mhm.
went to medical school at the Medical College of Wisconsin, and then I finished training at the Morehouse School of Medicine in
Yes.
Atlanta, Georgia. So big ups to Morehouse.
Big ups
My
to
clinic,
Morehouse.
big
And
ups to
that's where we
Morehouse.
met.
That's where we met.
That's
Exactly.
where we
It's
met.
fantastic. I'm so proud of you and your platform.
Thank you. Thank you so much. So tell us about Connected Minds.
Connected Minds is has grown from being a 100% virtual practice, started in 2019, to now we have our first physical location in Marietta, Georgia. And because of our
Wow.
physical location, we can do much more than just
Awesome.
medication management therapy these days. We're now into transcranial magnetic stimulation. So
Wow.
we use brainwave magnets to alter your brain
Oh,
waves,
wow.
and we treat depression with that. So far, it's indicated for major depressive disorder, and it's gaining popularity for anxiety disorders, addiction disorders, and peripheral nerve conditions.
Oh, wow.
We also do cannabis evaluations, Spravato, which is S-ketamine. So if you're interested in ketamine, we offer that there as well. Disability evaluations, anger management, group and individual therapy, and we built a gym. So you can work out at Connected Minds
Wait,
and be
wait,
part of
wait,
our.
wait, 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 wait. Go back a little bit. How did you build a gym in the clinic? Tell me the connect. Tell me.
If
I
you
understand that. So
if you
make,
know me, then you know
I
I'm a
know,
fitness fanatic.
I know. But tell me how. So how does it work, though? Tell me how.
So
Just a little bit.
you can either be part of our fitness program, which
Okay.
is group or individual fitness with a health coach. We have a fitness trainer
Awesome.
who's licensed and you can work with him. Or you can be part of our medication assisted weight loss program. We'll
Okay.
prescribe you those weight loss medications like Ozempic or
You see?
Wegovy or
Okay.
Orlistat. Those
Okay.
medications that help cut
Awesome.
down on your cravings and increase your ability to
Awesome.
utilize insulin and cut down on your sugar. We
Awesome.
prescribe those medications, but as a requirement to be part of our clinic, you need to be part of a fitness program because I want to make sure you do indeed lose weight. I don't want you just stabbing yourself in the abdomen every week and not losing any
Awesome.
weight.
So you're dealing with the mind and the body.
Yeah, dealing with the mind and the body is holistic.
Awesome. That's wonderful. That's wonderful. I've never heard of that. I've never heard that's an interesting concept, but I like it though.
Thank you.
I like it. So, you know what I do is more about hair loss, and most people just think that hair loss is just like, just hair loss from the name,
Right.
alopecia. But I was talking to a friend of mine, I was telling someone that I've had clients that come in and they're dealing with something else. And part of the symptom that we're seeing is hair loss.
Yeah.
So I wanted to know if you've seen clients or
Yeah.
patients. I don't like to say patients. I more like to say clients.
Okay.
Have you seen clients that come in with what? kind of mental health issues do you see, especially people that come in with, and you think something with that you can connect it to hair loss?
Yeah, hair loss in psychiatry is a real big issue. In fact, it depends on my setting. So let's take it one by one.
Okay.
In the inpatient setting, when I'm rounding on patients in the hospital, I mostly see hair loss conditions involving cancer treatments. A lot of chemotherapy agents will diminish your hair, either in density or total volume. When it comes to the outpatient world, some of the medications I prescribe, like the SSRIs, the SNRIs, these are called depression medications, selective serotonin reuptake inhibitors. They increase the amount of serotonin in your body, but they also have a horrible side effect of hair thinning. When you have bipolar or schizophrenia conditions, some of the mood stabilizing agents that I prescribe, like lithium or Depakote, cause hair loss. If you have ADHD and I'm prescribing Adderall or any stimulant, actually, including the antidepressant medications that we classify as stimulating antidepressant medications, like bupropion or Wellbutrin, they cause hair loss. And those medications like bupropion, it's also, we prescribe it for cigarette smoking and addictions. So a lot of the medications we prescribe cause hair loss. Even when I want to prescribe oral contraceptives, like birth control medications, they can cause hair loss. So I have to be really careful. I had a patient in New York that comes to mind. I started her on, she had beautiful, thick hair, very thick, 4C grade. And I started her on Wellbutrin and it started to thin. But Wellbutrin was the best medication for her condition. And so we just had to, go with it. And she just had to deal with it because there's not an alternative.
And that's the issue I keep having in clinic. I have patients that have depression, coming with all this medication, and they're having hair thinning. I'm like, we have to pick a battle. So it's always almost like a fight.
Yeah,
I'm like, what is really the priority? For me, is the mental health
it's
first.
always the mental health first. Yeah.
Always the mental health. So I tell them, hey, we can do other treatment to help with the hair thinning, but this
Yeah.
is really the cause of it. But I really find that patients really come to my clinic and they break down because their hair, because when you look at someone, the hair is the first thing you see.
Hair is the first thing you see, especially when you're black. Let's just call it what it is. Let's call it what it is. I'm ready to talk about it. Let's talk about it. When you're black, like even me, if I walked out of here today
Yeah,
in this interview,
yeah,
people will refer to me as the bald guy with the beard. They're not gonna say anything else. They're gonna say the bald guy with the beard because they're looking at the hair. As black people, hair is everything. It matters so
that's
much.
right. So there's another condition that I wanted to talk to you about, trichotillomania.
Yeah.
I have a, I'm telling you that. And my clients, they're always in denial
Yeah.
about that. So I always talk about, I have to ask them the depression questions. I
Yeah.
also have them, I have to go more of, go talk about their mental history just to kind of
Hmm.
know what's going on. Because when you come into the clinic, we ask you the basic,
Yeah.
history. Then our physical exam using our trichoscope, we'll see that there's an underlying problem because we see them pulling the hair.
Right.
The hair is basically
In the
broken. So
middle of the
yeah,
strand.
it's in the middle
Yeah.
of the strand. So I keep trying to talk to them, but it's very sensitive. So
It
how do
is.
we approach such clients? How do we approach those clients?
I think an interdisciplinary approach is best. I want to
Mm,
work with you and your clinic in a deeper level. I want
awesome.
us to have like a symbiotic relationship
Awesome.
where I can help you with these kind of clients.
Yeah.
Trichotillomania
Yeah.
is a condition that falls underneath the anxiety disorders, kind of
Mm,
like kleptomania.
wow.
So you get this anxious distress
Mm,
right before you start doing something that you shouldn't be doing. You
wow.
get this heightened anxiety,
Wow.
and then you start to steal. That's called kleptomania.
Mania.
You get this
Yeah.
heightened anxiety, and then you start to pull at your hair. That's
Mm,
called trichotillomania.
wow.
And these are anxiety disorders. These people could benefit from therapy. They could benefit from medication management. They could
Mm,
benefit from just from having a psychiatric interview. So if you
interview.
have these kind of clients,
Yeah.
Send them to Connected Minds. Let's see them virtually or in person, and let's work on the issue.
But what if they're in denial first? How do I actually break the ice if they're already in denial? How do I say, hey, there's something else going on?
Recently, somebody that I love really deeply went to the hairdresser and they said, your length issue is not due to you not using the right products or you not whatever, whatever. It's due to you taking your braids out incorrectly. And you're like crunching through the takeout process and you're breaking off at the middle of your strands. They said it flat out, straight out, and they just said it. It was difficult for that person to hear, but at the end of the day, they changed their habits because of it. Now, when they take their hair out, they use different products, different chemicals, and they take it out meticulously, slowly.
Okay.
Sometimes we, in this current society of being real sensitive to everybody's thoughts and problems, we do them a disservice.
Awesome.
I want to take it back to the '90s where you got it raw. It was what it is. Stop taking your hair out like that. Stop pulling at your hair. Stop grabbing at it. We need to find healthier coping skills for people when they're anxious. I can give you a stress ball.
Okay.
I can give you those rubber bands that like
Yeah.
snap on your
Snap.
wrist.
Yeah.
I can teach you other ways to breathe, and find a way to cope with anxiety other than ripping out your own hair. That's crazy, right? Don't rip out your hair. Your hair is beautiful. That's your crown.
That's your crown.
Yeah.
That's your crown. That's your crown. That's right. And it's more difficult in men because ladies were able to cover with wigs
Right.
and all that. But for men, when they come in with all these patches of hair loss,
Yeah.
and I tell them, hey, I think there's something else going on. And it's mostly my male
Yeah.
clients are always the ones in denial.
Yeah.
So what about the clients that come in and they want to stop some certain medication that they take for depression? They're like, hey, I want my hair
Yeah.
back. So is it advisable to tell them to stop the medication or they have to taper it? Taper it is for people that don't understand is stop it gradually, or they have to still follow up with their physician to make sure that it's safe for them to stop or taper it.
So first and foremost, there's not enough of us
That's
psychiatrists
right.
in the world
That's right.
or the United States, like
Mhm.
globally, right? So number one, first and foremost, is get them to a psychiatrist
Exactly.
because a lot of people are treated by primary care providers, and we love what primary care providers do. They're kind of like the gateway to the
Gateway,
specialist,
yes,
which
yes.
psychiatry is a specialty, so it's a step above that. And so they are the first people that people meet, and they do their best. But at some point, you got to refer them to a specialist, someone
Mm-hmm.
who's trained in treating this condition.
Mm-hmm.
So my first recommendation to you and any other hairdressers or hair surgeons is send them to a psychiatrist that you know and trust.
Mm-hmm.
We would love to see those kinds of people.
Okay.
The second thing is don't abruptly stop your medication because you don't know what condition that medication is stabilizing. And one thing I know is I would rather have no hair than be naked in the middle of the intersection, running up and down the street. You know what I'm saying? I don't know how that even happens. What the hell is
That's
that?
right.
Than me
That's
running.
right.
You know what I'm saying? So like, keep me off of the internet, please.
Okay. So you're trying to say that education is
Yes,
key. Trying to educate the clients about, hey, it's best for you to be mentally stable
correct.
than you to have a good hair
But I can
and be
help with the hair
with
loss,
the hair loss.
but I
Okay.
can only help in the context of an
In the,
interview in the clinic. So
okay.
it may not be that you have to be on that particular medication because some medications cause hair loss more often than others. I can
Mm-hmm.
switch you, but it has to be a
Awesome.
gradual switch where you might be on two at one time, and I'm
Okay.
taking the dose down on one and increasing the dose of the other, so you don't destabilize. So you gotta get into the hands of an expert.
Okay. Thank you so much for that education because it's really, really important to give the right
Yeah.
information. Like I'm big on the right information, and that's why I bring physicians to kind of, educate my audience, the clients, to know the right thing to
Yeah.
do so that they're not just hearing it from one person.
It's
Because sometimes
important.
I say no, and I know is the right answer, but they feel I'm being mean or something. But I'm like, no, it's not about that. I'm looking at the whole person. I'm not just looking at one part of the system.
Mhm.
Yeah. So I had a question. I kind of lost my train of thought.
No, you're doing
Um,
great.
yeah.
And you have beautiful hair.
Thank you so much. Thank you so much. And I suffered from hair loss. Okay, now yeah, I remember the question before I forget. Before forget, yeah. So what do you think when people say a lot of ladies that come in, they always say, I'm stressed out, I'm not anxious. So how can you, what is the difference between the two, or are they the same thing, or anxiety is more like the severe form of stress? I'm trying to understand because sometimes we just use the word I'm stressed out, or most likely the person is passing through anxiety.
Yeah.
So
I like what you're trying to
mhm,
do. You're trying to figure out the severity
severe, yes.
and how often it's happening to
Mm-hmm,
somebody.
mm-hmm.
Stress and anxiety are such ubiquitous terms that we just
Okay.
use all the
All the
time,
time, yeah.
but they really have lost their meaning over time.
Okay.
So, what I like to say is this: if you're having stress to the point where you're stressed out from the moment you wake up to the moment you go to bed, and it's every day or more often than not, which means majority of the week. So the week is 7 days. If 4 or more days of the week you're stressed out to the point where you're not cooking, you're not cleaning, you're not getting to work on time, you're not functioning at work correctly, you're not interacting with your loved ones and your peers the way you're supposed to be, you're not feeling good about yourself. If you're stressed like that, you have a condition, you have a
Mm.
disorder, and then I would call you anxious.
Mm.
If you're like episodic and you're just stressed out when things happen to you,
Okay.
that's actually normal.
Normal
It,
reaction.
it, it's
Okay.
normal reaction. If I'm in the woods and my cell phone signal's out and I don't know my way and I'm hearing animals and birds and stuff in the forest and I'm scared about, that's normal.
Mm.
But that's also called
Got it.
stress.
Got
That's
it.
not anxiety.
Mm. Got
That's
it.
stress. I'm stressed out because I'm in a heightened state of anxiety where it's like the fight or flight reflex
Yeah.
from my amygdala has kicked in.
Okay.
That's different.
Okay.
But if there's not a if there's no pinpoint thing that stresses you out every
Mhm.
day, you just feel anxious all day, every day, which means excessive worrying. Anxiety means excessive worrying.
Yeah.
If that's your life, then you have a condition, and we have
Understand.
medications to treat you
Medications to treat you. Okay. Got it.
and therapy.
So that.
And
Thank
we
you.
do holistic stuff at Connected Minds too. We do
Good.
yoga, we do
Okay.
meditation, we do
Oh
sound
wow.
bowls, and like I always say, exercise. The gym is
Wow.
not just to work out and be buff,
Walking.
it's for you to decrease your anxieties and your depression. Inflammation in the brain
The
goes
bones.
down when you exercise.
Hmm. Hmm. Wow. Okay. So wow. So everybody see, there's nothing to wait. What are you waiting on to go to
What are you
Connected
waiting
Minds?
on? And we do
Like,
virtual and
what,
in
I
person.
mean, virtual and in person. What are, like,
And if
he
you don't
has
have the
everything.
stuff that it takes, we'll mail it to your house. If you need bands, resistant
Oh,
bands, if you need
wow.
weights, we will buy it and send it to your
Oh,
house.
wow. This is like comfortable. Like you're just relaxing at home and everything is being sent to you.
Yeah.
Oh, wow.
The average milk jug, the average orange juice jug weighs about, 1 to 2 pounds.
Mm-hmm.
You can pick those up in your arms and do the workout with us virtually, and then we'll send you what you need from there
Oh,
forward.
wow. Awesome. I would like to sign up. I mean, I need the mind and body
Come
too. Hey, doctors
on.
need it too.
Yeah.
Okay, so I have another question. So I went for a conference, hair transplant surgeons conference recently in October, and they were kind of pushing this agenda about, I think hair transplant surgeons should start asking the depression scale questions,
Yes.
like the PH2, I think it's PH2 and PH9, like we
PHQ-9.
PHQ9, yes, to start incorporating in our questions because most people often or not they have something else going on
Yeah.
or body dysmorphia,
Mhm.
something else going on. So what do you say about that? Like, because it's very important because we really can differentiate someone that has body dysmorphia and someone that just really wants something for their hair. Because it's easy for people to travel
Yeah.
to Turkey or somewhere else to just go get a hair transplant. Then they come back to the clinic.
And
I'm
it's
like, hey, doc,
still,
yeah, it's still messed up. I'm like, hey, doc, this part, I need this part to be filled. Sometimes I just tell them no, no,
yeah.
no. So
I tell
what do you think about?
all of my
Mhm,
pain medicine physician
mhm.
friends the same thing I'm about to tell
Okay.
you. Marry yourself to a psychiatric practice.
Mm,
Speak to the psychiatrist
okay.
involved and create a pipeline program where they get a psychiatric evaluation first
Course. Okay.
before you start digging needles into things and doing
Awesome.
surgical interventions. let us have a chance to evaluate for other conditions.
Okay.
Let us send you the report and
Mm-hmm.
you go from there. As you continue to see how they respond to your treatment, which is you might transplant some hair follicles and they're still ripping them out, you, we can continue to support you. We don't want to be at the end of the finish line where you've done the hair transplant, they spent thousands of dollars and they ripped it all out of their heads, and now you want us to kind of fix that problem. Let's be part of the initial evaluation process.
Okay.
It works best that way.
Okay. Okay. And you said we can get a hold of you virtually for the clients if they want the
Virtually,
virtual clients, so
yes, or in
virtually
person. Yeah,
or in
absolutely.
person. So you're open to, if we refer clients to you, kind of to run things by you, kind of the client to talk to you before we do any hair transplant, or if we suspect
You got
something
my
else
cell
is going on.
phone number. You know you can call me
I know,
anytime.
but I'm saying,
Yeah.
so this is information so that the other hair transplant
Oh
surgeons
yeah.
will know that you are open to that.
Business to business
Hmm.
consultations I do all the time.
Okay.
And I love it. I love helping people before things get worse.
Yeah, worse.
So please, yeah, reach out, be a part of the intake process. We get even right now we get interviews within 7 days.
Mhm.
So if you really have somebody that needs to be seen quickly, we can
Mhm.
get them an intake within 7 days. And once we get the intake done, we have a diagnosis,
Okay.
medication management, and therapy comes right after.
Okay.
So you'll have notes. You'll know exactly what you're doing. If you can just say, hold on, two
2 weeks.
weeks,
Okay. Okay.
you'll have
Okay.
all the information that
Okay.
you need.
So what about clients that maybe really want to have their hair back and they're on some medication that's causing hair loss, like I already talked about the SSRIs and SNRIs. So what if they want to switch to something else? Like, is it advisable for us to switch them? I'm just let me ask let me finish talking so that I can go through that. Is it advisable? Can we switch them? Can we talk to you, call you, or call the physician that's taking care of their medication and their mental health issues? Or we should just refer them and let the psychiatrist handle it. Like, we shouldn't even mess with it.
Um, I'm a proponent of don't do too
Okay?
much. Stick to the rivers and the streams that you're used to.
Okay?
you
Yeah.
know, at
Got it.
some point, even though we all, as an MD, I could do surgeries, I could deliver
Yeah.
babies, I can
Yeah.
do a lot of things.
Yeah.
At
But
some point, you have to decide
got it.
what your specialty
That's
is
right.
going to be for your career.
And there's
And
also
if you're,
to protect you too.
yes, it is. Because when you go to court, they're going to say, how many cases of this have you done in a year? How many cases of that?
Mhm.
And if you're like, then you know how
That's
that's
right.
going to go.
Yeah.
So I would recommend that if you or anyone else is primarily doing stuff, let us take care of the medications. And
Okay.
if you ask the patient, are you actually seeing a psychiatrist or are you seeing an NP or a PA or a PCP, which means primary care provider, which is like a family doctor or internal medicine doctor? It
Okay.
might be time to elevate to a psychiatrist because at some point you might just need a specialist
Got it.
to take care of your meds. We
Mhm.
all need specialists for things.
That's right.
I'm a singer. I'm a
That's
singer.
right. Yeah.
And so
And
I go to an ENT for my
for
for my voice, my
the
vocal
voice,
cords.
yes.
Yeah.
Got it. Yeah.
You got to do
Yeah.
at some point.
That's right.
And
That's right.
so just my advice would just be if they're having issues at whatever level they are at when
Mhm.
they come to you, try and engage them to come to a specialist,
Mhm.
come to a psychiatrist.
I'm just a therapist. I mean, the same way before we do a hair transplant, we send them to a cardiologist if they have cardiac history.
Yes.
We send them to an endocrinologist if they have diabetes. We have to get clearance from all that. So, I mean, it makes sense.
It
Like,
makes sense.
it
Yeah.
makes
And
sense. I
we're
mean,
happy to
you kind
help.
of not think about this until you kind of sit down. I was like, wait, this is what they do. So you need to
Yes.
get clearance from them.
Yes.
Got it. So is there like a hard no? Like once you see a client, like, we talk to you about a client, maybe they're scheduled for hair transplant in 2 weeks or a week from now. And like, and you say, no, I don't think this is advisable. This is a hard no. There's no possibility, there's no maybe, nothing's a hard no. Is there any case like that? For my hair
There
transplant,
are certain.
so I'm telling you, this is very important because the hair
It
transplant, they
is.
we like to push it. I'm like, okay, maybe we can do that and get away with it. Is there like a hard no? Say, no, don't do this. No, it's a hard no.
There are certain
Okay.
conditions that pose a problem for us diagnostically and recommendation wise, no matter what the condition is. For instance, when people want to transition their genders,
Okay.
we
Okay. Yes.
have to really be smart about how we interview them. We have to
Okay.
be smart about how many times we interview them so we can see is the gender staying constant or is the gender decision changing a lot. We don't want to
Yes.
recommend a gender transition on
Thank you
people
for that. Yes.
back and forth on their processes
Yes.
because then that's going to lead to an adverse outcome.
Yes.
Same thing with the hair transplant. If your issues are truly that your environment around you doesn't support how you feel about yourself,
Mm-hmm.
I don't think you should be transplanting your hair. I think you should be changing your environment.
That's right.
If you have a medical condition or let's say you're a gentleman and you lost your hair at 19 and it's affecting your self-esteem, I think you're an ideal candidate. But
That's
if
right.
you're trying to change your hair because of your partner or because of how society views you or all these other things, if you're schizophrenic, if you have borderline personality disorder,
Mm-hmm.
if you have extreme bipolar disorder and it hasn't been treated, if you have personality disorders otherwise unspecified, we need to handle that with therapy before we start digging around in your scalp. We need to make sure
We
that
need
when
to
you
make
get
sure,
your hair transplant, you're gonna like it,
and
you're
it's
gonna
gonna
be
stay
happy, and you won't want to reverse it. That's the
because people come female, female to male to female, female to male, because they want to change the shape of their hairline and all that. So it's like this is a lengthy process. Hair transplant, people don't understand is that it can last anywhere from 6 hours to 12 hours. I just had hair trans. I did a procedure on someone yesterday. We started 12 p.m. We ended this morning,
you were
4
still
a.m.
transferring follicles.
Yes,
Oh wow,
4 a.m.
that's
this
like at least
morning.
8,000 follicles.
4 a.m. this morning. I'm not joking.
Wow,
I went home, I slept for a couple of hours, and I'm here to just talk to you. Like 4 I'm not joking. 4 a.m. this
wow,
morning.
that's crazy.
So people don't understand. It's not just saying no to you, it's not just doing the surgery, it's not all that.
Yeah,
There's a whole process
hmm
to it. And you don't want to make that mistake because there's a lot of expenses to be made. You made that, put that money into it. Now you're regretting. Now you're
and the
not taking
time
care of your
commitment.
body. Yes, you're not taking care of your mind and your body, like you said.
Hmm.
You're not taking care of the right things, and that's what we tend to see. How we usually know people that are seeking, or let's say they're seeking, or have body dysmorphia is when they're doctor shopping,
Yeah,
when they're doctor shopping, or when
yeah,
they're not satisfied with their results.
right.
Because we always tell people the first thing is that we have to manage their
Yeah,
expectations. You're not going to have a head full of hair. We're just going to do what we can. So when people come doctor shopping, so that's what triggers it. But I want us to go beyond just that trigger. I want us to also be alert, like
yeah,
your other hair transplant surgeon, to understand, and people to understand that sometimes it's not just the hair loss, there might be underlying issue going on.
yeah.
So
It's
thank you
true.
for saying something about stress, differentiating between stress and anxiety, because most people come in and say, "Oh, I'm just stressed out." Everybody's almost stressed out. I
Everybody's
think
always
everybody.
stressed out.
Yeah. So I want to understand the thin line between stress and anxiety. So when you're saying that, so when it's affecting the person's daily activities, so you're thinking more of anxiety.
Yeah, then I'm thinking, do you have generalized anxiety
Exactly.
disorder? But stress is normal.
Mm-hmm.
You're supposed
So
to
stress is
be
normal.
stressed because if you're
Yeah.
not stressed, you'll get hit by a car because you didn't realize you're in the middle of the street.
That's
You know,
right.
stress is
Got it.
normal. If you don't
Got
have
it.
stress, you won't write your paper by the time it's supposed to be done
Oh,
because you
that's
won't
right.
feel a need
You won't
to.
feel the need to. Got it. Got it.
Mhm.
Okay. Good, good, good. Especially for ladies. Now, for men, is there any signs that we need to watch out for? Because some men are good at hiding
Yeah,
the anxiety.
yeah,
Now, I'm going to say anxiety because, like you said, stress is every day.
yeah.
So, is there something, what we can, are there questions we can ask, especially my male clients? Because, believe it or not, most of my clients more male walking. So are there questions that can trigger us or we can ask to kind of make sure that we're not missing? Um,
Are you here in Atlanta or where
I'm
are
in
you?
Peachtree City, Georgia.
Okay. One of the biggest questions that I ask, and it might be a biased or loaded question, but I ask it because I'm in Atlanta. I ask, how much weed are you smoking?
Got it. Yeah, that makes
How
sense.
much weed are you smoking? A lot of people use marijuana to cover up their issues. Another question is, how much are you drinking?
Got it.
So basically, substance abuse kind of masks
Got
the anxiety issues.
it.
Going below that, how much are you eating? Are you eating more? Are you eating more carbs and sugars? These are indicators that you might be stressed.
Got it.
How much are you sleeping?
Got it.
When was the last time you hung out with your friends? A lot of men, when they get stressed out, they tend to isolate.
That's right. Yeah, even my husband too. So so that kind of I get on him for that. Like, why are you by yourself? Like, it doesn't make sense.
Things are all
Yeah,
right in his life,
that's right.
and he doesn't feel like he deserves
Got it.
to hang out until he's got all his ducks in a
That's
row.
got
But this
it.
is life, and life is a continuum. You may never have all your ducks in a row, but you
Mm,
still have to live your life. You still have to be happy and healthy.
mm, got it. So if you say they're smoking a lot, so that is number one.
Well, marijuana in the short phase can help with anxiety,
Yeah.
but chronic use of marijuana changes the brain in a way that
Thank you.
makes anxiety and depression worse.
Thank you for
Worse to
saying
the point where medications are not as
that.
effective.
That's
So,
effective.
chronic marijuana use is not advised.
Thank you. Thank you. Because people come in and say, I've been smoking it for 20 years. How about that?
And I'm like, and you're here in front of me. How about that? Welcome to the psychiatry office. It's
So,
going
so
so great for you.
I can't say that. I can't say you're in front of me. How about that? But you can say that because you want to be blunt. I can't say that. I mean, I'm trying. I have to be nice because
Yeah.
I feel maybe I have to be a little bit more
Some people need a
sensitive.
dose of reality, though.
That's right. I mean, you can do that because that's what you're supposed to do. But I'm more focused on their
Yeah.
hair as long as. Got it. So got it. So what about sleep? What? So you said something about sleep because a lot of people suffer from insomnia. So now it's funny because look at how you've all related everything to all parts of the body, like all parts of this body
Yeah.
system, like sleep, insomnia, and people don't realize that it can be showing up as anxiety if you're not sleeping. So look at how you just related all that together. Chronic marijuana
Mhm.
use, So this is really
And
interesting. So we're
more and
trying.
more than that, insomnia is one end,
Mm,
hypersomnia, sleeping too much
yeah.
is the other end, and both can indicate you're depressed or anxious. Because if you're in bed all day, it could be a
Okay.
symptom of avoidance. I don't want to
Mm,
tackle what I have to deal with today. So I'm just going to stay in bed where it's safe and I'm going to just eat and watch TV or just be on my phone or just like avoid my responsibilities because they're so overwhelming. And another
got it.
thing that I love about Connected Minds, the gym comes with a health coach. So we talk about your nutrition. The American diet is a strange diet. And nutritionally, some vitamins are just missing. Some minerals are just missing,
Got it.
especially when you eat fast food or you eat out a lot. So these are things that contribute to hair loss as well.
Mm,
We need zinc.
yeah.
You
Yeah. We do.
need vitamin C.
Yeah.
You need these things to contribute to your hair.
That's good. Yeah. That's right. That's right. That makes a lot of sense. That really makes a lot of sense. Wow. So you basically have everything in your clinic. So is it just one stop shop? Like I just send them, if they're dealing with something, hey, why don't you go see this person and come right back to me? I'll be
I'll
right here. So
be
it's
right here waiting
yeah.
on you.
And I think I need to also tell physicians don't be in a hurry to do stuff.
Yeah,
It's actually right to help your clients. You might not be able to do everything, but it's your duty to direct your clients the right expertise or the right specialty where to go to. It's okay not to know everything. It's okay not to do everything. And it's okay to say no.
yeah,
That's
it's
right.
true.
Okay. That's right. Okay. So that's nice. That's really, really, really good. Okay. So let me see if I have any more questions. Nobody has said anything. Any questions? Let me see. I can see people are joining. Thank you guys for joining. Talking with Dr. J. He's the owner of Connected Minds, and he deals with the mind and the body and the soul,
Yeah,
actually. So,
absolutely.
and the soul. I mean,
And
I'm going to add
so
the soul because. So, tell us a little bit about TMS. I've heard about TMS, but I don't really know. It's a long name,
it
but
is.
TMS, I know. So, tell me a little bit about TMS. Does it really help,
Yeah.
or have you seen? Mm-hmm.
The studies indicate that depression kind of remits somewhere around 80% or more in
Okay.
these cases.
Okay.
It's called transcranial magnetic stimulation, which means we place a coil over your head. It doesn't touch your scalp.
Okay.
It generates magnetic waves at a certain amplitude and frequency that I set on the device based on your motor threshold. So the first initial step will be I put the cap on you. I draw lines all around your on the cap to figure out where your motor cortex is and where the cortexes that I need to amplify to treat your depression.
Okay.
And every time you come, we'll put the cap on and I'll know exactly where to stimulate your brain with
Oh, wow.
magnetic waves. No electricity is not electroconvulsive therapy, it's not the electric chair. We are using magnets. Okay? We're using magnets. The treatment lasts about 20 minutes to 30 minutes. You'll come 5 days a week for a total of 6 weeks, but we
Mhm.
can stop it at 4 weeks if
Okay.
you feel like you're getting better.
So it's every
And
day? Did you say every
every
day?
day,
Oh,
five
wow.
days a week,
Wow.
five
For,
5 days a week for about 4 to 6
oh, wow.
weeks. Insurance does cover it. Medicaid,
Okay. Yay.
Medicare, all commercial insurances cover it. And if you're paying out of pocket, it's about $300 a session.
Okay.
Um, it's really remarkable. What I like about it is you don't have to change your life. If you
Mm.
drink a lot, if you drink every day, if you binge drink, if you smoke, if you do cocaine, whatever, you're actually supposed to keep doing all the things you do because we can't have you changing your brain in the middle of the
You
treatments.
know, the treatment.
So whatever you show up as day one, I need you to be that by day
But then
30.
after got
Yeah.
it. So you're trying to say, so do you also have to be on medication while you're on the
You
treatment, or
You don't have to be on medications, but if you are on medications, I like you to stay on them so you don't change your treatment. And one thing about it that's really connected to this conversation is your
mm,
hair. As a woman or as a man, actually, if you show up day one with a shaved head or with braids, you can't change your hairstyles.
mm,
I need to be able to amplify at the same location every visit.
got
So keep your hairstyle the same.
same.
Yeah.
Got. So what if they have weaves in? So they have. Can you still do what you
I
have to do with the
can
weaving?
do it on any hairstyle, but if you take your weave out and now you have a silk press, that changes. Every millimeter difference changes. And I don't want you to not get the effects you want. And I also don't want you to have bad side effects because now I might be stimulating too strongly
Yeah.
because you had big box braids and now it's like a smooth hairstyle.
Got it. Okay. So they can still be on
Yeah.
antidepressants while they're on the medication. So then how do you know there's an improvement if they're still on everything they're doing from day one to day
Because
30?
nothing changed except I started stimulating you. That's why I don't want you to change anything.
Got
If you
it.
start taking meds away or putting or increasing doses,
And
then
that's
I
it.
won't know what
No,
the TMS was capable of doing.
got
But
it.
by the end of your TMS treatments, if you're feeling so much better, you're like, I want to reduce my doses, we can reduce your doses.
Got it. Got it. So compliance is key.
Yes. And
Gotcha.
consistency is key.
Consistency is key. Okay, good. Okay, good. So, is there any way doctors can reach out to you? Is there somehow we can, because it's good for us to stay connected because,
Yeah.
like as we discussed now, see how everything is intertwined to each
Yeah,
other,
everything.
so how can doctors, hair surgeons, even, I mean, other primary care physicians reach out
Yeah.
to you if they
Yeah.
have a question or want to refer? Because a lot of clients come in and they have a counselor, they have someone they're talking to, but
Yeah.
they've really only seen a psychiatrist 10 years
10
ago.
years ago. It's
I'm like,
true.
you can't be on the same medication 10 years. Mm-mm. Something
I
is not
agree. I don't understand it. Well, you can find me at 678
working.
383 9532. Again, that's 678 383 9532 or www.connectedmindsllc.com. or you can come to our clinic at 2155 Post Oak Trick Road, Suite 300 in Marietta, Georgia. And either way, you can email us at scheduling@connectedmindsllc.com.
Okay.
There's a million ways. You can also just Google us. We've been
Google.
really good about our online presence. And
That's
so
right.
if you just type in Connected
You will
Minds, you'll
find
find us.
them. I promise you, you will find them. I have done my research, and you can find them. Even though they didn't invite me for when they opened the
We
clinic,
didn't
but I
invite you?
still no. Okay. Okay.
Okay,
Yeah.
well,
No.
you know what? Whenever you want a private tour,
Okay.
we'll pop champagne and I'll take you
Yes.
all around the clinic.
I saw you popping champagne. I'm like, okay. Hmm.
You know I like bubbles.
I know, I know. You're very fancy, and I like that. I love physicians that are very fancy. I love physicians that are very blunt, that go straight to the point, because at this point, there are a lot of misinformation.
Yeah.
And once a physician goes straight to the point, I actually appreciate
Yeah.
that. That's it, because we want to keep consistent physicians on our
Mhm.
platform, because we like physicians that can tell us how it is. Like, this is
For
it, that's
real.
it. I'm not changing my mind. I'm not trying to sugarcoat stuff. And I like that. Like you said.
Exactly.
I'm gonna say that if you've been using it for a while, then why are you sitting in my chair? I'm gonna use that. I'm just gonna say it in my mind, but
I'm like, and if you don't like what I have to say, that might be why you're still stuck where you are.
yes, and I'm going to keep watching out for them. And also, if there are ways that you can, sometimes physicians, like, sometimes we're also stuck in our ways. So it will be good for us to, if we can come to your website and we know what to look out
Mhm.
for, like, the PHQ. Now we talked about PHQ too, because they really emphasize this for hair transplant physicians, so that we can understand. And
Mhm.
most people, like, we're way back, we don't even understand what it is anymore. Like, so, but I had to go back and read, and like, what's PHQ? So I have to include it in my history
Yeah.
taking. Or sometimes I usually ask the ladies, do you spend a lot?
That part.
So kind of little some little things like that. And so thank you so much. Like, he's been really, really helpful. Do you have any
Thank you.
final words for
I'm
us?
I'm very proud of you and your
Thank
platform. This is fantastic. Please
you.
invite me anytime. I'm always doing these. In fact, later on tonight, I have another podcast I'm on called The Father's Advocate
Wow.
with an attorney
Wow.
talking about the role of black men as fathers and how the election has affected us as black
Mm,
men. So I'm always doing podcasts. I love community outreach. If you have any charity events, you ever need a speaker,
yeah.
I'm there. If you have a patient that wants to just talk, maybe they don't want a full consultation, they just want to talk to somebody and see if psychiatry or therapy is a right fit for them. You have my number. Just use me however you need me. Anytime you call on me,
Don't even
Nancy,
worry
I will be
about that,
there.
because you're on speed dial. When I sent you a message, it's like, who is this? I'm like, I had to explain myself a little bit. I'm like, this is this person, and you kind of got to say, yes, okay, I remember it. So don't
And
worry about that. I have your
anytime you
speed
call on
dial.
me, I'll be
Yeah,
there.
sure, I know that. Thank you so much, Dr. J. And your name is very
Yeah,
easy to remember. So, Dr. J,
yeah,
everyone,
pretty
don't
much.
say the name is too long for you to pronounce. No, no. His clinic is Connected Minds. He deal with souls, your mind and body and soul. So I don't want to hear that you don't have a psychiatrist. I don't want to hear that I can't go. I don't have an appointment. I don't want to hear that. So before you come to the clinic looking for a hair transplant and looking for a head full of hair, I need to start adding, where is your clearance from
Where's
for
your
the
clearance from Dr. J?
I think I need to start adding that, because I'm tired of dealing with expectations, because I'm trying to give you my expectation, but you had yours, so we kind of clash. So
Yeah.
I think I'm going to be getting the expectations from you.
I'm surprised you're not sending everybody to the Turkish hairlines.
No, I'm like, no, because the problem is sending everybody to the Turkish hairline. No, 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 no. But the problem is that when they get back from the travel, these cosmetic travels they do, they now come to a physician to manage
Oh,
it. I'm like, you see, my problem is that this hair looks like it's gonna die in a couple of months, and once I take it over, and it becomes a liability to me, because now, because if as a physician you want to give your best,
yeah.
and I'm like, checking up on you, like, I'm asking you to send me pictures. Now, once I see this, actually someone committed ended his life. I put it on my post. Somebody ended his life because he went to Turkey to have a beard transplant, and found out it was a real estate agent that did the beard transplant. Yes. So, because the outcome was bad. You see what I'm saying? People think it's just hair transplant. There's an artistic part to it, there's a cosmetic part to it, there's a medical part
Yeah.
to it, there's a follow-up part to it.
Yeah.
So I tell these are all the parts that you can't get when you travel out
It's
of the country.
true.
So he actually ended his life when he realized he was a student. He was tight on cash, and he used his money because they sell you all these deals.
Yeah.
Pay $1,000, and you get your flight, you get your hotel room, and you still. So when they go over there and they kind of see the place, it's not them to back down, but because they've committed their money
Right.
and all that, they can't back down. So they go ahead with the
Yeah.
surgery, knowing that something is not right,
Yeah.
and then now come back.
Yeah.
Then expect you, how can you fix it? No, I'm not gonna have you having hairs moving this way, opposite direction. Yeah,
And
so
your hairline looks
and
like a line across your head.
yeah. So people notice when you have fake hairline.
They do.
Just they don't say it, but they notice there's
They
something is
notice.
weird going on. So
Hmm.
and so that's it. So it's very important. Thank you so
Are
much. We're gonna definitely
you
reach
doing
out.
platelet-rich
We
plasma?
do all of that. Yes,
Yeah.
we do all
Okay.
of that. We do all of that. So thank you so much. I'll definitely reach out to you. I think I'm gonna be needing clearance from you with so many
I
clients.
got
So
you.
yeah, I'll do
Thank you so
that. Thank
much,
you so much.
Nancy.
Bye
Bye,
bye.
y'all.
Bye.